Does postpartum bleeding affect future pregnancies? Imagine holding your newborn and then facing unexpected heavy bleeding afterward. Postpartum bleeding is common, but it can raise questions about future pregnancies. Let's explore what the facts say. After giving birth, many women experience bleeding called lochia, which is normal and lasts for several weeks. But sometimes, the bleeding becomes heavy enough to be classified as postpartum hemorrhage. This is when more than 500 milliliters of blood are lost after a vaginal birth or more than 1,000 milliliters after a cesarean section. It's a serious condition but treatable. Most women who have postpartum hemorrhage during their first delivery do not face fertility problems if they had a vaginal birth and no surgical complications. Their chances of conceiving again remain similar to women who did not have heavy bleeding. However, if a woman had postpartum hemorrhage combined with a cesarean section, her chances of conceiving within 5 years might be slightly lower. This is because cesarean deliveries can sometimes lead to scar tissue or other issues that affect future pregnancies. Experiencing postpartum hemorrhage once does increase the risk of it happening again in future pregnancies. The more times it occurs, the higher the chance of heavy bleeding happening again. This is true regardless of other risk factors. Causes like weak uterine muscles, retained placenta, or vaginal tears can contribute to repeated postpartum hemorrhages. Women who have had postpartum bleeding should tell their healthcare providers about it in future pregnancies, so preventive steps can be taken. Having procedures like dilation and curettage after a miscarriage or abortion can also influence future bleeding risks. While postpartum hemorrhage itself does not cause infertility, severe bleeding or surgical interventions might affect future pregnancies. Emotional recovery is just as important as physical healing, especially since postpartum bleeding can be stressful and cause worries about future health. If you experienced heavy postpartum bleeding, keep your healthcare team informed before your next pregnancy. Early prenatal care and monitoring can help manage potential risks. Remember, many women go on to have healthy pregnancies after postpartum hemorrhage. Supporting your emotional well-being and maintaining a healthy lifestyle, like staying at a healthy weight and avoiding smoking, can also help reduce risks. In summary, postpartum bleeding usually does not reduce your ability to get pregnant again, but it can increase the chance of heavy bleeding in future deliveries. If you had a cesarean section along with postpartum hemorrhage, your chances of conceiving again might be a bit lower. Open communication with your healthcare providers and proper planning can help you navigate future pregnancies confidently.